Capital News with Charles Gishane.
Justice Minister says March 4th poll on as planned. Kibaki Raila assure Bensouda of government support in ICC cases. And government to roll out new health scheme for the poor. Welcome and thank you for joining us. Now let's get right to our top stories of the day. Justice Minister Eugene Wamalwa says the date set for the poll will not change because all the preparations are on course. He, however, says that the Independent Electoral and Boundaries Commission will on Wednesday brief the two principals and the country on a revised roadmap of the election and the factors that have caused for delays. Speaking after meeting EU ambassadors, Wamalwa said that the French and Canadian envoys to Kenya had committed to ensuring the delivery of the biometric voter registration kits is fast-tracked. He insists that the BVR tender was a one-off procurement and all other processes are well on course, including civic education. Head of EU delegation to Kenya, Lodvik Bright, confirmed that the BVR kits were being produced at a rate of 1,000 per day and will be ready for delivery in good time.
Also been very clear that whoever is responsible for the delays, Kenyans need to know who that is, and we will be able by tomorrow, as we converge and brief our principals, to say where or why there have been delays in the process, and these are issues that Kenyans have a right to know. And anyone who is responsible for these delays, if they're deliberate or otherwise, really would be doing what is not in the interest of Kenya, and that would amount to sabotage in my view. So we have said we want Kenyans to know we are determined to ensure everything stays on track, and if there are any probably maneuvers or deliberate moves to delay the process deliberately, we will inform Kenyans accordingly and let them know who's responsible for that. Thank you.
President Mwai Kibaki and Prime Minister Raila Odinga have assured International Criminal Court's prosecutor Fatou Bensouda of the government's commitment to a free and fair election next year. The two principals have told Bensouda that there will be no more violence in Kenya during and after the March 4th general election because all necessary security measures are in place. During the closed-door meeting at Harambee House, Bensouda told the two leaders that she specifically flew in to seek ways of enhancing cooperation between Kenya and the ICC. She has also assured the two principals that the ICC will carry out its work guided by the principles of impartiality and independence in the pursuit of justice. Kenya's Deputy Prime Minister Uhuru Kenyatta and Eldoret North MP William Ruto, who intend to contest for the presidency in next year's election, are among 4 suspects facing trial at the ICC. The 2 other suspects are former head of civil service Francis Modhaura and former journalist Joshua Arap Sang, who are all accused of crimes against humanity for allegedly planning or financing the post-election violence. Bensouda has assured that the court does not intend to interfere in any way with the ongoing political processes in the country, although she insists the court's calendar will not change. And finally, the government is planning to launch a new health scheme dubbed Indigent Fund, targeting 9 million Kenyans who live under the poverty line. National Hospital Insurance Fund Strategy and Planning Manager Marwa Chacha says the government has already rolled out the pilot phase and will expand it to the grassroots level next year. Chacha says the entire scheme will cost 23 billion shillings once it is rolled out and will be funded by the Exchequer. Chacha argues that the poor need an exclusive scheme because they have been historically delineated from the main health scheme. He says a framework for identifying those who fall under this category has already been developed. The Federation of Kenya Employers has, however, cast doubt into the government's ability to fund the plan, saying it does not contribute anything to the NHIF. Head of Research and Policy Advocate Lineth Oyugi says the government is not well prepared for the project.
Indigents are basically the people who are unable to provide for themselves, and they compose of about 19% of our population currently. In terms of numbers, we are talking about something 8.9 to 9 million. And basically, these people have been excluded from the main healthcare delivery system. They've been unable to get healthcare, resulting to very poor conditions when they fall sick and actually ending up in death. So what we are doing as NHIF and the government is to try and see the means and ways that we can be able to finance the healthcare for these people, find the best way of delivering that healthcare to them at the most feasible price.
And that does it for our top stories of the day. Thank you for joining us. I'm Charles Gishane.